Good morning, ladies and gentlemen. This is Aisha Shahi from the National Health Insurance Company Daman, and I am part of the disease management team. Thank you for joining us today in Ramadan webinar. We welcomed Ramadan several days ago. May you and your family have a blessed and a peaceful holy month. Ramadan is a special time for reflection, self-improvement, kindness, and fasting is one of the key pillars of the holy month. Dr. Abeer will take us in a journey on how to stay healthy during Ramadan. On a side note, please know that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end to answer your questions. Without further ado, let me introduce our presenter for the day, Dr. Abeer Sultan Al Naqbi, Family Medicine Consultant in Ambulatory Healthcare Services, SEHA. Dr. Abeer, welcome. The floor is yours.
Thank you, Aisha. First of all, Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody, and Barak alaikum shahr. Wish you all, inshallah, blessed Ramadan. Actually, today, inshallah, we'll have some like a talk that will help us to really get Ramadan with its full blessings, both spiritually and health related side, because it's a really golden time to improve many of the things that we need in this month. So inshallah we'll go into very like simple tips that will help just reset our mindset and reset our thoughts regarding our health, spiritually and physical health during Ramadan, inshallah. So welcome everybody, and thank you for being here today. So let's start with our talk today. Inshallah, we'll be discussing healthy fasting during Ramadan. We can go first to the first slide. As we all know, Ramadan is it's a month of spiritual reflection, self improvement, and devotion, and to improve the connection with God, as it's a purely it's a purely a month for really getting a stronger connection with Allah. This by itself helps to, we can go now to the next slide. This by itself helps to purify the soul from our other 11 months where we are really devoted in the lifetime things, lifetime obligations. So I think it's really wise to get this month purely just to purify our souls, get our connection stronger with Allah, so we can have a really good booster for the next coming 11 months, inshallah. We can go now to the next slide. In addition to these benefits, as we all know, Ramadan with its fasting really helps helps us to practice patience, self-discipline, and self-controlling manners as we are fasting. And as we all know, during fasting we need to be patient as much as we can, just to get the much benefit, religious benefit from this holy month. And now we will just speak more about the health benefits, physical health benefits of fasting. So if we can go to the first one. So here we are talking about some of the benefits that are well known from studies that has been done in humans, and some of them in animals too. But generally, fasting is very well known, good reason to boost our memory and to boost our thinking and memory capabilities. Yes, some of you might say like we are shut down whenever we are fasting, but I mean, we will talk inshallah later about other factors that can help us, like, because most of the time people in Ramadan maybe will have some sleeping disturbance, which we will talk about later, inshallah, which can affect memory and thinking. But if we get the proper advices and the proper sleeping hygiene manners, we can really get the benefit of fasting in boosting our memory and our thinking abilities. Let's go now to the other one. For heart health, it is very well known that fasting improves blood pressure, resting heart rate, and other heart-related metrics. And this is already well established by fasting. Let's go to the other one. Okay, regarding physical performance, some of the people will say, like, to be honest, this is one of the things that I can face whenever we discuss physical activity during Ramadan with some of my patients. So they will say, like, oh, doctor, I'm really tired. I cannot do anything during Ramadan. I think some of these ideas are just fixed. Many did not try to do proper physical examination. Inshallah, we will speak more about physical activity during Ramadan. What are the best timings? What are the best activities that we need to do in the later slides? But generally, fasting really helps, and these are all research based. It's not just opinions, it's a research based. So really fasting helps to lose the fat, sorry, and to at the same time retaining muscle mass if the proper exercise was done in the proper time. Again, some of the studies done on mice demonstrated that fasting also helps to give greater endurance while running and while exercising. So fasting is supposed to help really to make a proper and better physical activity, not the opposite. And just doing the proper exercise in the proper time, which we will discuss, will help you to get into this. Let's go to the other slide. Again, fasting is considered like this is one of the other things that we always also hear, and sometimes we always also during our social chatting we talk about it like, oh, Ramadan is coming, I'm gonna gain weight, I'm gonna have problem fitting my dresses for Eid. So as Ramadan is really a golden time to lose weight. Just a few tips, inshallah, that we will discuss today will really help to get into this goal. Because fasting can help to weight loss and to prevent obesity as well. In the first hours of fasting, we will use our glucose in the blood. Later on, with the upcoming hours, we will start to use the fat. If we eat properly after iftar timing and certain types of food, with this benefits of fasting, by the end of Ramadan, we will be losing weight instead of gaining weight. The only problem that really prevents people from getting this opportunity of losing weight is that after iftar, they will replenish the body with all of the fat that has been lost and all of the sugar that has been lost by choosing, let's say, inappropriate choices of food that can really prevent them from getting the golden opportunity of losing weight in Ramadan. So fasting and chronic diseases. Now we're going to, inshallah, we'll go back to the diet and exercise and all of these things by the end of the presentation. Now I'm just going to tackle on one of the important points, to be honest, in Ramadan, which is fasting for people with chronic diseases. As we know, like most of the families, for sure, one of the family members will be either diabetic, hypertensive, or having any chronic disease. So there are certain advices. We can go to the next slide. There are certain advices that we usually give to the patients with the chronic disease that they have to put in mind before Ramadan, or even in the beginning of Ramadan, just to consider. So any people with chronic disease we always advise them to seek medical advice and to check with their doctor, to visit them ideally 6 to 8 weeks before Ramadan. If Ramadan already, we started already Ramadan, alhamdulillah. But whoever did not do this step before, it's advisable to do as soon as possible. Just to, there are certain goals of this visit. The main important goal is to just to check whether this patient is safe to fast or not. As we know, alhamdulillah, like our religion is really very understanding and very I mean easy in when it comes to health issues, and the safety of the patient comes in priority. So the physician who is following with the patient needs to check their general medical condition and then decide whether they are safe to fast or not. And then according to this, the decision of fasting or not will be done then. The other point is that it's very important also before Ramadan or in the beginning of Ramadan to control the chronic diseases. For example, if the patient is having high blood pressure, or the patient, for example, is having, he is diabetic and he's having low blood glucose levels at some times, these needs to be controlled before Ramadan, because again, the full purpose and the full goal of Ramadan is to really get the full benefit of it, spiritually and physically. So we want everyone to be fasting and not fasting, I mean to go through this holy month with the proper health, get the full benefit of it. So controlling these chronic diseases before Ramadan is really important, so they can get the full benefit of Ramadan during that month. One important thing also is to develop a lifestyle plan. So the full goal also is to individualize or personalize this visit to that patient. So we cannot say that all of the patients, like for example with hypertension, needs to yes, there are general advices for certain kind of people, but I mean it's very important to individualize the treatment plan. For example, this patient will need to take this medication at this time, this for example 2 times or 3 times per day, depending on their situation. So we cannot always generalize the treatment plan, dosing and timing for all. It needs to be individualized. Again, diet also is different. Some people will have to have different kind of diet. Certain medical conditions needs, for example, restriction in fluids. Others needs to increase the fluid intake. Some will need low salt. Others will need higher sugar. Like it depends. So it's always advised to be visiting their physician. The last point is to again, as we mentioned, diet and the treatment plan also needs to be all individualized for patients. Now, I'll in the next few slides, I'll be discussing just general advices about certain common medical chronic diseases. For the sake of the time of the presentation, we cannot go through all chronic diseases because, again, it needs to be individualized, but these are some of the common, very common chronic conditions that we see on a daily basis, and I think it's very important to give some general advices about them because most of the houses have 1 or 2 individuals having one of these diseases. So if we go through hypertension, we always advise to check the blood pressure before fasting to determine whether they are able to fast or not. People with very low blood pressure, if they are before starting, they already have low blood pressure. Again, it will be discussed with their physician what are the readings, the exact readings for their condition, for their general situation, for their age, what is the acceptable reading for them to be fine, fast or not. The other point is to because we know hypertensive medications can lower blood pressure, so we advised always to take the hypertension medication, generally right after Tarawih prayers, but because by that time the patient already had good amount of fluids, had some food, so if he or she took the medication at that time, he would be well hydrated, so the proportion or like the chance of having low blood pressure will be less. If for any reason the patient forgot to take their hypertensive medication, pill, just take it whenever you remember. If the same day already passed and you did not take the medication, take it next day. Don't double dose the medications. Again, general advice for the hypertensive patients, we advise them to reduce their salt consumption in food because it increases their blood pressure. Now we will discuss the diabetes. So for diabetes, generally also, we have, maybe for diabetes, we have a little bit more advices, but generally we advise diabetic patients to regularly monitor their or check their blood glucose level, especially in the midday when they are fasting, and whenever they have any symptoms or any signs of hypoglycemia or hyperglycemia, high blood sugar or low blood sugar, and this needs to be also discussed with the patient and the family. Generally, I'll just go through the symptoms briefly in the next slide. But for now, so we said regular blood glucose monitoring is very important for diabetic patients. As we said, discussing individual plan with their physician in advance or just in the beginning of Ramadan if they did not come before that. For food, we always advise to increase fiber. And generally, to be honest, this is an advice for like everyone. I don't say, I mean, everyone really needs to go into this, like increasing fiber intake, because when you take something sugary, for example, if you start with rice, which is not advised, but I mean, whenever you combine a meal which has carbs like bread, pasta, rice, if you take it alone without any fiber, without any vegetables, any protein, then the glucose absorbed from that carbohydrate portion is more and it's absorbed quickly during the body, which will increase your insulin. Then it will cause you to be more hungry and you will be hungry quickly. So you will crave for another carb again in a short time. So always advisable whenever we are consuming any carbohydrate, whether it's rice, pasta, for example, bread, combine it with vegetables, combine it with protein. This will help to reduce the absorption of glucose from that carbohydrate portion. And this will not cause the body to give a very strong spike of insulin. And this by itself will not cause you to be hungry shortly after the meal, which will help you to be more full for a longer time. And this will prevent you from eating a lot and again of more carbohydrates. So this step is really important. Water intake, again, keeping hydration is very important also, especially for diabetic patients because they are not prone to dehydration and because of the long fasting times. So we need to get hydrated on a regular basis. Again, we go into that joke every Ramadan, not to get to be like the camel type, where people will not drink anything and then suddenly before suhoor, just before suhoor, they will consume the whole amount of water, which is not beneficial much because it will just go quickly out of the body without getting the true benefit. So it's better to just take the water on a regular basis in a few amounts. To be honest, I always advise myself and I advise my patients to keep the water in front of them. It will be ideal, not the perfect thing, but to be ideal to have the full amount that you need. For example, get a bottle of 1.5 liters, keep it in front of you from time to time just to drink it, because and that way you will remember, especially if you're at home, and that way you remember that, okay, by the time from aftar to suhoor, I need to finish this 1.5 liters bottle of water. So whenever you look at it, okay, I need to drink some water, then you will remember. This is one of the tips that will really help, especially if you're staying at home at that time. And then we go into the adjustment of medications. Again, it will be individualized. Timing of some medications, diabetic medications will be adjusted. Dosing will be adjusted also. Some of the medications will be reduced. Some of them will be changed. So it has to be discussed also. Some of the medications needs to maintain good proper water intake. So this is also another important point. We always advise everyone, not only diabetic patients, to have a good regular exercise daily. Again, for diabetic patients, there are some advices that I would really want to tackle on regarding exercise. So we advise to light to moderate. What is light moderate? Light moderate means something like walking, brisk walking, like mild running, cycling. This is considered mild to moderate. But again, cycling might not be appropriate for everyone. Maybe walking, it depends on the brisk walking will be maybe the most common thing that we see. It depends also on the physical activity of the person before Ramadan. So whoever, like for example, someone is not used to do any exercise before Ramadan, and during Ramadan suddenly he or she would decide to be very healthy, and they will do like a vigorous exercise. We don't advise to this because the body is not used to it. So if you are not used to have any exercise before, so we advise for mild exercise, like for example brisk walking. It is really good. For diabetic patients, I will speak about the regular, normal people at the end, inshallah. But for diabetic patients, we advise them, especially, alhamdulillah, now Ramadan comes in a good time weather, so it's good even to walk outside. But for example, when it comes to hot weather time in Ramadan, we don't advise them to do it before iftar, because they will have to do it outside, which will mean that they will sweat more. The probability of them to have low blood sugar will be more. So it's not really much of advice. And so we advise diabetic patients to do it as much if they can indoor, or if they want to do it outdoor, we advise them to do it after iftar, not before iftar. So the probability of having low blood sugar readings and all of the complications will be less for them. Okay, now I'll speak in the next slide about some of the I can tell red flags or critical readings, numbers that every diabetic patient needs to know and need to memorize. So, and this is also the importance of getting the blood glucose monitoring, checking it regularly. So if the blood glucose reading is less than 70 at any time of fasting during Ramadan, so these are the 3 times where the patient has to break their fast immediately. So if at any time the blood glucose is less than 70 milligram per deciliter, or like 4 millimole per liter, they need to break their fast immediately, even if it's like 30 minutes before iftar or 1 hour before iftar. This is very risky because blood glucose level can go low very fast, and getting it really low will get the patient into a risk of really risky complications. So this is not a number that we just can ignore. It's not. So whenever it's less than 70 at any time of the day, just break fast immediately. Another reading is for patients who have high blood glucose levels. If it's more than 300 milligram per deciliter or 16.7 millimole per liter, again, break the fast immediately. You said, okay, why to break the fast? I'm already having 300 milligrams. You need to take your medications, which will be mostly, people with this reading will be mostly having they are taking insulin, most of them. So they need to take their insulin. They need to, after the insulin, because the insulin by itself will cause them will cause the blood glucose to be lower, to control it. So for sure they will need to eat something after the insulin. So this is the point of getting them. Plus, they need to hydrate. They need to drink enough amount of fluids, of water. Why? Because if we have this high reading of 300 milligrams, it means that the blood the body has a lot amount of sugar, which means that the body will be dehydrated, because sugar will increase the urine to go out of the body, which means that the body will lose a lot of fluids, which means that the body is dehydrated. If we kept this, we did not break fast, and we kept this, it will cause the patient to be dehydrated, plus the dehydration that is already there due to the fasting, which is really, really risky to the patient, for the diabetic patient. So they need to break their fast again, either less than 70 or more than 300. Less than 70, if they did not break their fast, it kept going down and down, it can get them to go into coma, which is really risky. So that's why we're really tackling on this. If the patient have any symptoms of hyperglycemia or hypoglycemia, they need to break their fast. What are the symptoms? I just go through them very quickly. Symptoms of hyperglycemia is, again, they will feel they are going to they will have a lot of urination, so they will go frequently to the washroom to do the urination. They will feel thirsty. They will feel more hungry, more than usual that they are used to for fasting. And again, the reading will be very high. Hypoglycemia or low blood glucose level, it will cause them to be sweating. They will be more irritable. They will have tremors, shaking. They will feel very fatigued, they might feel their heart to be racing quickly. These are symptoms of hypo or low blood glucose level. One of the important things I would really tackle on diabetes is family members needs to be really involved in this. They need to know. I always advise that, especially before Ramadan, that one of the family members are there in one of the visits, because they need to know what are the symptoms, what do they need to notice on their family member if he or she have any symptoms, and what to do about it if they notice this. For example, because sometimes if the person has really low blood glucose level, they might not be able even to move from their place if they have low blood glucose. At that point, they might not be able even to move to get something sugary to help themselves. So if this did not happen, then if the family member doesn't know about it, they don't know about the readings where it's important for them to break the fasting. They don't know what are the symptoms, what they will look like, what they will complain of. If they have low blood, they will not know how to act, and this is really risky for the patient. And so family members are really important to be involved in this too. Again, I always advise also patients to have nearby, especially if they are sleeping near the bed, to have like juice or to have sweets, anything, honey, just beside them, in case if they have any low blood glucose, so they can save themselves in this. This is very risky, so they need to be careful. Now we will go to the, I think we are done with diabetes. Now we will go through the general advices for everyone, general advices about their the food, the exercise. So now the question is, okay, how can we lose weight in Ramadan? How can we use this month to lose weight to help us to get the full benefit from Ramadan? I will share some of the advices. Inshallah, it will help everyone to get into their goal of Ramadan. So let's first start with sleeping. Okay, I will start with sleeping. Why? Because it's our struggle, Ramadan, and because if we did not control this, we will not be able to do anything else. So sleeping in Ramadan, let's go to the next slide. Yes, so actually this picture makes me really I want to sleep now. Okay, so first try to get regular sleeping pattern. I know that sleeping will not be as sleeping hours are not much compared to the regular days, but at least we need to get them regular. For example, same sleeping times, same awaking time, at least this will be really helpful to the body, because the more regular the sleep cycle is, the more benefits you will get from the sleeping hours that you are getting if it's regular. And the other tip is that we wanted to get regular because we want to get uh, more of longer periods of sleep. Like if I know it, Ramadan will be challenging, but at least if we say 4 hours, for example, so from after Taraweeh, after Isha, until the time of Fajr. So at least if we have a minimum of 4 hours, this will be really good. Again, it depends on the working hours the next day, so you can adjust. If you can have more than 5 hours from after, I mean, before Fajr time, it's even better. If not, at least 4 hours, and then you can wake up for the Fajr prayer. And then you can have like 1 or 2 hours if possible, depending on your working time, before your day starts. Um, and then after that, it's also advisable to have a nap. Now, I want to speak about something very important regarding the nap. Okay, so the nap has to be maximum 20 minutes, not 20 hours. Okay, so the shorter the shorter the nap, I mean, it's advisable to be 10 to 20 minutes. Because um, we know that there are the sleep cycle that we go into, that our body goes into stages. So we have something called deep stage. So the nap has to be in the stage where it's still not the deep stage. If you go into the deepest stage of sleeping, then we all know what will happen. The mood will be X. Then you will need like 2 or 3 more hours to get your mood back into normal, and then you will have headache that you don't really like it, and you will need I don't know how many cup of coffees just to get your headache out, just to be back again into your mood. By that time your day is already done. so so getting an nap of maximum like 20, maximum 30 minutes is really beneficial. I know sometimes when you go into the sleep, it will be really challenging to get again. But I mean, just to try it once, get your alarm and try it once, get smaller nap and see how do you feel. It will be really different. You will feel a big difference. It will be a bit challenging to wake up in the beginning, especially if you're not used to having that kind of short nap. But with time, you will feel really much better. You will feel more refreshed. Your mood will be okay for the next of the day, and you will not have this kind of bad mood and bad headaches that we all encounter if we have this. So having a shorter nap would be really helpful. And then again, the sleeping environment is really important. Getting a dark place with the proper AC conditioning. I mean, the temperature that you really like to sleep in. Again, one of the things that I want also to tackle on is holding the phones before sleeping. It really disturbs the sleeping quality, I can tell. Yes, because you are tired, for sure you will sleep. Whether you hold a phone or you hold a full TV, you will sleep because you're already tired. But the quality of sleep will not be really much of, and some people will be really will have some challenges to get a good sleep if they are holding any like iPad, iPhone, or they're watching TV, because as we all know, they are the lights and radiation coming from the type of light that's coming from these devices really disturbs the hormones and the sleep cycle rhythm in the body. So advisably, like at least I would be just maybe a little bit of realistic. So it's ideally at least 1 hour, not 2. But let's say at least try 30 minutes before that. Actually, one of the things that really helps to get good sleep is getting rituals before your sleep. So for example, it depends, like you can choose whatever you like to do. Like for us, we are used to have like our prayers, tasbih, reading Quran, all of these things before prayer, before sleeping, sorry. This by itself prepares the body that, okay, she's doing this, so yeah, she's going into sleep after a while. So yes, this helps the body, to be honest. So these rituals, I assume it doesn't need a phone. So, so getting these rituals will really help you to get into the goal, not to use that devices before sleeping. And already we spoke about having good sleeping environment. Let's go to the next slide. This slide is a bit of content, but I just want to go through the general things out of it. So some of them we already spoke about. Is just getting a regular sleep cycle. So these are general things that will really help you to get benefit from Ramadan. So getting a regular sleep cycle. For food, start the iftar with something like soup, water. If you want to have dates, you can get laban with it, because also we want to get that combination of protein with the glucose, as I mentioned previously. So we get the good glucose from the dates, and then we can combine it with laban, so it can get some protein, which will prevent the absorbing the glucose so quickly from the dates. Or you can start with soup, which is also a good, really good option for that. Generally, we advise to stay away as much. I know we cannot do it. We like the sambusa in Ramadan. We like القيمات in Ramadan. I will not say stay out of it, because myself, I know I like to eat it, but we need to just maintain the proportion. So not to get into like 10 samosas, 10 algimats, okay? So we can go into 1, 2 maximum if we really like it. Options of like frying, we can use either the oven or the air fryer if you have, instead of frying it in the oil, for example, and it's really tasty, it's really crunchy. Now I'm doing some advertisement, but it's really good options to do. And it's healthier, it has the same taste, and it's really getting better. And then we have the so generally fatty food, sweets, we advise always to get the minimum as we can. If we can stop it, it's perfect. If not, the minimum much that we can. Don't forget to, I'm advising myself, to be honest with you, together. So don't forget to get some salads, because also we're having a long fasting time. No water is there, so the chance of having constipation also increases with Ramadan, because we're fasting, we're not getting really good much of the fluids, we're concentrating more on carbs, and then we will drink coffee, which will also increase the water out of the body, so it will increase dehydration. These all can cause constipation. So getting good proper amount of fruits, vegetables, especially salads, good amount of water will also help to reduce this problem in Ramadan. As I said, water, take it on divided amounts from time of iftar until the time of suhoor. This will replenish the amount of water needed by the body in a really good way. We can go now to the next slide. Physical activity, the very common question in Ramadan: what are the good time of exercising during Ramadan, and what can I do? What exercises can I do in Ramadan? So let's go now. I will explain the proper 3 times of exercise. Okay, so there is no specific time that I can tell this is the best time of exercise in Ramadan. There are 3 different types. It depends on you. It depends on your preference, on your schedule, on your environment, how active wear you before Ramadan. So the first time is after suhoor. After suhoor, which means like in the daytime, in the morning, for example. So there's an advantage of this, that you already took your suhoor, so you have some power to do exercise. But the disadvantage of this is that after exercise, you will fast for a long time. So in this time, we don't advise to do heavy exercises. Like, for example, those who are used to do heavy lifting, muscle building exercises, it's not really the good time to do it. It's good for like brisk walking, those who like to do some jogging, some mild cycling. It's a good time to do it, but not for like heavy lifting and all of these things, because after heavy lifting and after vigorous exercises, you will need really good power food after that immediately. So this is the first option. The second option is to do it before iftar. Before iftar, which means, and when we say before iftar, we prefer the hour before iftar. So because this advantage is that after exercise immediately, you will have iftar. So you will have really good power after that. So you don't go into the risk of being really fatigued, really hypoglycemic, or all of these things. So you have good time to do it. Again, the same exercises that applies for the first time and applies to this. So we advise again for walking, jogging. Some people would like to do cycling. They can walk into the treadmill, do the cross machine. So you have many options. Again, heavy lifting depends also on your fitness before Ramadan. If you're not used to it, it's not advisable to do it in this time of the day, because you're already at the ending of your fasting, so you will not have that power of getting heavy lifting, so you might put yourself into a risk of injuries. But this will be tailored according to you personally. And then so maybe the most common time that people use is after iftar. And we say after iftar, the best time is like 1 to 2 hours after iftar. So alhamdulillah, yani our day of prayers is really getting our schedule very planned. So after iftar, we go into Taraweeh most of the times, which by the time you end from Taraweeh, it's already 1 to 2 hours after iftar. So at that time, after Taraweeh, after Isha prayer, it will be really good time to do whatever exercise you want. Now you have the green light to do any exercise that you want. Heavy lifting, vigorous exercise, because you're already in your full power, and you can do whatever exercise you want to do. It's a good time to do it. Now, if your iftar was so heavy and was so full of sambusa al-gaimat and haris and farid, you will not be able to do this. You will be able to do it, but you will be very heavy to do it. So it might prevent you even from going to do it. That's why I'm telling, like, Ramadan is really good, gold opportunity to do it if you just have the things on their time. I mean, we can divide our meals. We can have iftar and dinner. So this will help us to have the good meal, to have the good power for Isha, Taraweeh, and doing some exercise. After exercise, you can go back and have some dinner. So you can distribute we can distribute our meals so that we can get into the opportunity of having whatever we like to have, and doing the exercise and doing the rituals that we need to do it. Actually, doing a regular kind of schedule, having exercise by itself to be is one of the things, and it's very well known and studied, that it really improves the mental health, and it improves your happiness. We all know, and it's very well known, that exercise, when you are exercising, your body produces endorphins. These are hormones, the happy hormones, they call the happy hormones. So that they really improve your mood. They really improve your well-being, and some of these hormones even helps in reducing the pain. So people also with chronic pains, one of the treatment that we advise them to do is to exercise, because these are regular internal hormones from the body that helps the body to reduce pain. So it's not only about weight, it's about your mental health, it's about our well-being, it's about reducing general pains that are not really necessary for some of the reasons, because having weak muscles and having a weak body, with time you will have weak joints. With time you will have, like, that's why people are saying that, oh doctor, why all of us now we are having knee pain, and with minimal injury they will have like fractures, knee pain, dislocations, because the muscles are not strong. People are not exercising. And when we say exercise, we need aerobic exercise, and we need some muscle strengthening exercise, to be honest. This is very important, and it really helps to stabilize the joints. It really helps to get you into stronger joints. Like, I really feel sorry when I see young patients, like 20s and their 30s, or even sometimes younger, having like knee pains, back pains. Like, it's too young to have it. The main thing is that they are really lacking exercise, or they're concentrating only on aerobic exercise of running, walking, and they are ignoring the muscle strengthening exercise, which is really important, at least 2 or 3 times per week. So this is one of the points that I really want to tackle on, even after Ramadan. This is just out of Ramadan, but I just remembered the point. So, but it's really important to do it. If you don't want to start it in Ramadan, if you're not used to it, after Ramadan, consider it, or you can start it mildly in Ramadan and then continue on it after Ramadan, inshallah. Okay, let's go to the next slide. And so yeah, I think we're just getting into the end of the presentation. So take-home messages that I want really to give is, Ramadan is really it's a really holy month. It's a really golden opportunity to just reset reset ourselves, like spiritually, mentally, religiously, our connection with Allah, to reset our lifestyle as a whole, our sleeping pattern, reconsider our health, our diet routine, our exercise routine. It's a blessing time where we can really reset everything, our relation with others. I think it's really good to it's really wise. I can tell it's really wise to get the full benefit of this holy month from all aspects. And as I mentioned in the presentation, again, it really helps in losing weight. We are just automated on certain thoughts that no, Ramadan, I will gain weight. No, it's not. I think just consider this Ramadan. If you did not consider it in the previous times, just consider this Ramadan as a reset month. I'm telling you, it's not a Ramadan. It's not a month to gain weight. No, we are just automated on this. It's not. It's really a good time to lose weight. It's really a good time to get healthier, to adapt newer, healthier lifestyle for your whole life. We have many purposes in life that we need to get them to be done. We need to be in our appropriate health. If we are not taking ourselves, not taking care about ourselves, we will not be able to take care of for anyone else. And our purpose of life will not be established if we did not do this. So please take care and get it a good time to reset. I maybe I did not mention this in the previous slides, but it's a really, again, golden time for smokers to quit smoking because of the long fasting hours. It will help them. Again, as we all know, in HS clinics, we have smoking cessation clinics. There are some things that can be used to help them during their fasting times, like, for example, nicotine patches, and all of these things that it will help their craving times and during their fasting, and it will help them to go through this difficult time for them. And by time, it can help them to quit smoking, inshallah. So I think it will be also wise to get advice from the smoking cessation clinic regarding this for smokers. It will really help them to get an easy time during the Ramadan, and maybe it can help them, inshallah, to quit smoking too. Again, as we said, I mean, stay hydrated. Maybe I will expect, inshallah, everyone to have their 1.5 liters bottle of water beside them today, inshallah. So we can remember to get well hydrated during from iftar to suhoor, and not to get the camel type of drinking water just before suhoor time. Regular exercise. Let's start today, inshallah, all together. At least walking. Let's start with walking. If you can do something else, is good. 30 minutes will be more than enough. Will be more thankful. Your body will be much thankful if you did at least 30 minutes. If you want to do more, if you can do more, do it. If not, 30 minutes will be more than enough for the body. But just get good walk. I mean, not. I mean, get a good walk that you will feel your heart rate is getting faster, your breath is getting faster. And finally, sleep hygiene, very important. If you did not sleep well, you will not be able to do any exercise. You will not be able to do any other thing. So sleep well is getting good sleep is really helpful for that. Nap. Try the nap. Try the 20-30 minutes nap this day, inshallah, and give me your feedback after that. Inshallah, you'll feel much better about it. So I hope that we went through the things. It's just a brief advices. I hope that inshallah it will give you good tips for this Ramadan, and it will give you different Ramadan vibes, inshallah, this month. Final slide. Let's go to the final slide. I pray for myself and for yourself, inshallah, in this Ramadan, we will have the opportunity to go into that holy place. If not in Ramadan, inshallah, anytime, but I'm really hoping, inshallah. It is just a dua, and by the end of this presentation, I really wish to go in Ramadan to Mecca, and I'm really praying this Ramadan, inshallah, we'll get the opportunity to do it. Thank you very much. Thank you for your listening, and your questions are more than welcome.
Thank you, Dr. Abeer, for such an informative presentation and the much needed tips during this month. Now we will allocate 5 minutes, okay, to answer the audience questions, and we have a couple of them. So, Doctor, who should not fast during Ramadan?
Yes, to be honest, this is I can tell it's a bit of broad question, but it depends on the clinical situation of the patient. For example, if patient, I will just give some examples because there are a lot of categories, but generally, people who have any medical condition that will cause them to be like, for example, people with diabetes who have frequently, they are having hypoglycemia or low blood glucose readings before Ramadan. It is risky for them to be fasting. So this will be one of the categories. People who have, for example, chronic kidney disease, that fasting and dehydration will put their kidneys into a risk of getting damaged. They will be prevented from fasting in Ramadan. People who need to take medications orally, for example, or through the IV, and this cannot be postponed until the timing of the medication cannot be postponed of time. Also needs to be they will not be allowed to be fast. So it's a broad category. That's why we always advise that every person who have a medical condition to get the advice from their physician before starting Ramadan, or at least in the beginning of Ramadan.
Mm-hmm. And Doctor, we spoke about the importance of getting enough water, but what are the signs and symptoms of dehydration?
Yes, so the first sign and symptom of dehydration is feeling thirst. This is the first one, and then the other thing is that you can find dry lips, person can feel fatigue with the dry lips. The urine output will be less than usual. But the first easiest sign is thirst. Another one sign easy thing that you can know whether your fluid intake is enough for your body or not. Sorry for saying that, but I have to say it is the color of the urine. So the color of the urine ideally has to be, it shouldn't have a color. So the darker the urine is, the more dehydrated you are. So you can notice the color of the urine, and it will help you to know how dehydrated you are. So the lighter the urine color, the more hydrated you are. So this is an easy way to know it also.
And doctor, about caffeine consumption. So how to deal with headaches related to caffeine consumption?
Yes, this is very important question, to be honest. So what we can do, usually we advise to start before Ramadan, but since we started already Ramadan, so you have two options. You can take your caffeine intake at suhoor timing, if you're really used to have caffeine. But if you will do this, just make sure that from iftar to suhoor you got a good amount of fluid, because as we all know, caffeine kicks the water out of the body. So if you are not taking good amounts of fluid between iftar and suhoor, and plus in addition to that you are taking also coffee at suhoor time, it will make you also more dehydrated. So just maintain your good fluid intake between iftar and suhoor. And at suhoor, you can take your coffee shot that you like to have. One of the tips that can help, because we know that we have some headaches sometimes. People who are used to coffees can have some headaches. And this is normal because of the caffeine withdrawal. So you can also take like Panadol tablets, like 2 tablets of Panadol at suhoor time. It will help you also to have less headaches during your fasting, especially in the beginning of the fasting hours. It will also help. So get Panadol tablets if you're really having bad headaches because of the less caffeine intake, and you can take your caffeine shot at suhoor time. But putting in mind getting really good fluid intake between iftar and suhoor, inshallah it will help.
And doctor, we spoke about diabetes and blood sugar readings and when to break the fasting. So in this case, if the blood pressure was high, should we break the fast?
Yes, again, the blood pressure reading is because, as we know, the target of the blood pressure reading depends on the age group. It's different between age group, and it depends also on the clinical condition, general clinical condition of the patient. But yes, again, if it's really high blood pressure reading, especially when it comes with symptoms like with headaches, with chest pain, with difficulty breathing, with nausea, these are emergency signs. So if blood pressure comes with headache, blood pressure comes with nausea or vomiting, or it comes with chest pain or difficulty breathing, take yourself to the emergency. If no symptoms, no headache, no chest pain, no shortness of breath, no nausea, vomiting, it's only blood pressure which is really high. Yes, because you need to take your medication. But again, as I told you, it has to be individualized, and because we need to know the general condition, how risky this will be on your health, and what is the high reading that you need to break your fast, depending on your clinical situation, because this needs also to be between IFTA and clinical condition. So we cannot just generalize it to all. For the blood glucose, yes, we know these are like well-known things, and it's already خلاص يعني it's already there, we know about it. But like other conditions, depends on the situation, whether what is the line that we have to break. But yes, if it's really high blood pressure, it will be risky for the patient, so better to get their medications.
And doctor, last question. Any special advice for Umrah in Ramadan from a health perspective?
Yes, and this is also another good question. So Umrah in Ramadan, again, the main problem, It's not a problem. I mean, the main health challenges that might be there. So first of all, getting the vaccines is very important before Ramadan, before going to the Umrah. So and the vaccine needs at least 10 to 14 days to work to start the body to have the antibodies for the vaccine. So there's no point to get your vaccine 1 day or 2 days before the Umrah time. So get your vaccines ready. If you know, for example, you have a planned time for Umrah, just make sure that to get your vaccines taken at least 10 days or 2 weeks before that. This is the first important thing, because you don't want to have any infection there that will get things worse. The second thing is the dehydration. So getting exposed to the sun, not getting enough fluids because of fasting, in addition to the Umrah rituals that you will do, like tawaf and all of these things, these all will prone you more to dehydration. Alhamdulillah, it's tiyasir by Allah, yani for sure for an Umrah, but I mean, just make sure that, again, the day before, you get your enough fluid between iftar and suhoor. Make sure as much as you can get into the shade areas whenever you are doing prayer. For example, if you have a shade area during Umrah, it will be better. Sunblock also will help to prevent the exposure to the sun, and then after iftar, get enough fluids, maintain your fluid intake. For those who are diabetics, for example, for those who have diabetes, make sure that you have in your pockets or in your bag something sugary, because you never know. You know, sometimes with exercise, with exertion, this is considered like an exercise for them. So they might have lower blood glucose because they will need more glucose from the body to go into the tawaf and all of these things. So if they are doing the get word while they are fasting, their blood glucose might be lower. So they might have hypoglycemia during this. So it's always wise to have some sugary thing in their pockets or in their bags in case they have any signs of hypoglycemia. Then to get it quickly. Again, get your personal prayer mat with you. Get your mask, better, especially in the crowded areas, because a lot of infections will be there. Generally, in travel, we advise to avoid any street foods, uncooked food, getting fast food and street food, because you don't want to have into any food poisoning, which will get you into diarrhea, vomiting, and all of these things, which will increase the dehydration. These are the general advices I would say for Umrah. But really, hydration, maintaining good fluid intake is very important. I would say it's the most important, and get the vaccines before that, inshallah.
This was our last question for the day, Doctor. Thank you for such an informative presentation again, and being with us here today.
Thank you, my dear. Thank you, all of you, for your preparation and for your help in this session. Thank you so much.
Thank you, Doctor. Dear audience, this is the end of our webinar. Please take a moment to answer the survey questions. Your feedback and inputs are appreciated. Moreover, note that you can view the replay of the current webinar as well as previous webinars in our YouTube channel, Dhaman Insurance. Thank you for joining us today, and special thanks again to Dr. Abeer for your valuable input. Looking forward to meeting you all at our forthcoming webinars. Stay safe and have a blissful Ramadan.